Hey guys, Dr. Davalin, board certified laser dermatologist. Today we'll be talking about cyst extractions and how I perform them. The whole idea with extracting cysts, apart from the entertainment value, is to actually help the patient. So there are steps in regards to cyst removal. First of all is to create an entry into the cyst. The second bit, which is the fun bit, is squeezing the cyst. The third bit is to destroy the cyst wall or to extract the cyst wall. And last of all, it's to repair basically the entry wound which we create. So in this video, I show you how I do it using a 4mm punch biopsy. So this is what we call a cookie cutter or punch biopsy to create that little hole which gives us entry to the cyst. So thanks for watching, guys. Okay, the first step is cleaning the area. You can see the cyst looks rather small, but you'll see very shortly how large it actually is. So step one basically is entry into the cyst. And what I use is a 4mm punch biopsy to gain entry. So this is first person viewing, so I've got FPV glasses on. So you can see me drilling a hole which is 4mm in diameter, very small. The procedure is comfortable because it's under local anesthetic. So once I get the entry, it's a nice gentle squeeze. It's rather deceiving because I'm getting quite a lot of contents out for such a small entry hole. And this is the fun bit, the squeezing. So I'm trying to extract as much of the contents out as possible. And it's totally painless for the patient because he's had local anesthetic injections. So there's still more to come with some gentle pressure. This whole process takes about 1.5 to 2 minutes to do. So once all the contents are extracted, the next step is to actually try to remove the cyst wall itself. So this is destruction of the cyst wall because we don't want this to be recurrent. So I remove the cyst and the cyst wall. So there's more contents coming out from there. So you can see the cyst wall has been taken off and taken out. And shortly you'll see I use a pair of scissors to cut out the cyst wall itself. So we don't want this to recur. So I use some forceps to begin with. Grip the base of the cyst. And then use a sharp pair of scissors and basically just cut the base of the wall. So this is removal of the entire cyst wall over time. So that's the remainder of the cyst wall which gets sent for testing. So here I am just removing the last portions of the cyst wall. And this takes about 1 minute or 2 to do. Most dermatologists also use a process known as hyfrication. So we use basically a diathermy or hyfricator or heat to destroy the cyst wall and also to make sure that the bleeding stops. And last of all is closure of the wound. So I'm using sutures here to evert the wound. This person I know is a personal trainer, so he's going to be training a lot, so I'm giving him quite a fair few sutures to reinforce the wound. So remember, it's only a 4mm hole It's quite a big cyst. It'll heal up within the next 10 days. So I'm reinforcing the sutures so he can go up to his normal activities within the next few days. So that's the whole process, guys. So there you have it, guys. That's what I do to relax, is to actually do cyst removal. You can see that this procedure itself is simple. It's one of the simplest procedures I do. I use this to unwind at the end of the day, and it is relaxing both for myself, the patients, the nurses. A very simple but stress relieving procedure. So thanks for watching. I'll do more of these videos in the next couple of weeks or couple of months. Bye. If you are a popaholic, please remember to subscribe, because I do post at least 1 or 2 videos every month in regards to cyst removal, blackhead removals and extractions. And I'm also on Instagram, so I'll be posting more videos over the upcoming weeks. Thanks once again for watching. Bye.